Hi everyone, Dr. Vangard here. Welcome back to the channel. So today I want to talk about the difference between cash pay patients and insurance-based patients. So a lot of times when physicians are transitioning from being employed and they want to start their own business, the likelihood of starting your own business is going to be towards cash pay. That is what I did. I started with direct primary care and then switched into aesthetics and weight loss, which is what I do now. And so a lot of times people don't understand that if you're going to be trying to get a patient to pay cash, the mentality of that patient is going to be very different. Okay, so insurance-based patients, they are dependent on insurance for their health. A lot of times those patients are not going to be willing to pay cash for health services, right? And so if you have a practice that is all insurance based, you might find that only 10% of those patients are going to convert, because in their minds their insurance is supposed to pay for their health, and a lot of times they're not willing to go the extra mile to get better care, because again, in their mind, the insurance model is supposed to do everything for them. Of course, they don't understand that the insurance model is broken, and it's going to be difficult for them to get the level of care that they want, especially for medically or complex medical patients. The level of care that they need is just not going to be, they're not going to get that level of care from the insurance model. One, there's not enough time. Two, the doctors are burnt out. Three, it's going to take a long time to see specialists and all of that, versus the cash model. You don't have to go through all of those roadblocks, but they're not aware of it yet. And a lot of times those patients, they're not going to be paying cash unless they're in some form of pain. Okay, if somebody has high blood pressure, diabetes, heart disease, and their medical condition is stable and is being managed by medication, there's no incentive for them to pay cash to continue to get the same level of care in their minds, right? So when you're going to start a cash pay business or a cash pay medical practice, you need to understand that the demographic of people that you are targeting is going to be completely different. You want to find people, or understand that the people who will pay cash are people who identify as people who want to be healthy, people who are proactive, right? And people who have gone through the health system long enough to understand that that system is not working, and they're looking for an alternative system. And those are the people who are going to gladly pay you cash for the type of service that you offer. It could be direct primary care, it could be concierge medicine, weight loss, whatever it is. But the insurance patient is not going to pay cash typically for your services. So when you go in and you're starting your marketing and all of that, it's not advantageous for you to try to market or convert your old insurance-based patients. It's just not going to work, because the mindset is different. Telling someone to pay $99 a month or $150 a month when they pay for insurance, in their head they're just like, what are you doing with this money? They don't understand that you, as a business owner, you have overhead, you have to pay insurance, you have to feed yourself. They don't understand that, right? And so they're not going to be keen on giving you extra money for what they deem to not be necessary. So again, when you're starting a cash pay business, you're looking for people who have pain. Okay, they are in pain. Someone wants to lose weight, they want to lose it now. They've gone through the system, maybe the system has not helped them, maybe they're having difficulty getting medication, and the weight is giving them like major pain, right? So they need to lose weight. Someone's thyroid is not working, or they have whatever the issue. Cash pay patients are in pain. They have gone through the system has not helped them, and they're looking for an alternative. So when you're doing your marketing, target those people, talk to those people, talk to the people who identify as healthy people or who want to be healthy people, talk to the people who have gone through health issues and the system has failed them, talk to business people who understand usually that their health is going to be tied to their business, tied to how well they do in business. So the demographic that you're talking to in this situation is totally different. And if you understand that, you're going to be much more successful with your cash pay medical practice, as opposed to trying to convert insurance-based patients into a cash pay mindset. So I just had a conversation with a physician, and they're really struggling with this because they didn't understand this concept. So I figured I would just come on here, make a video for whoever is watching. I would do more more videos on my experience as a cash pay physician, because I did this pretty much right out of residency and I have a lot of knowledge. If you want to book a consultation, like for consulting services, because you want to start a cash pay business, or you want to start an aesthetic business or a cash pay telemedicine business, I'll leave my contact information below so you can reach out and we can talk. Okay. All right, I hope you found this video helpful. I'll see you in the next video.